Unfortunately, this is a revision case, but fortunately, the orthodontist did a really nice job, and this is a congenitally missing lateral incisor case. So let me show you what that means. So in this case, he came in and said, I don't like my teeth for a few reasons. One is obviously the color of those teeth. They just don't look the same as my natural teeth. The length of them, I don't understand why they're sticking out. And also, why are my teeth gray? I didn't realize my teeth were gray. All three of these factors have to do with the fact that this dentist used materials that I currently don't use because I bond porcelain instead of cementing metal. And I'll show you exactly what that means. But how did we get here? A congenitally missing lateral incisor case means this patient, he had these two side front teeth, these two teeth completely missing. He was born like that. There's no tooth up in the bone. It is just missing. So you have a few options. Option one is you use something called the Maryland bridge, and option two is you place an implant. But for somebody that's very young, you can't place an implant until they're 18 years old or stopped growing, because you can't place an implant into a bone that's still developing and growing. So in this case, for very young patients, we use Maryland bridges. They either can or don't have to be a permanent final restoration. So you can see where that gray hue I was discussing coming from. And the reason is because these are metal Maryland bridges, and that metal is fully bleeding through over there. So once I remove that metal, you can see all of a sudden the color of these teeth come back to exactly what his natural teeth are, and that is common right here in congenitally missing lateral incisors, that the tissue dips in, and the difference of width in that area is definitely different than the adjacent teeth. So when building the Maryland bridges, you have to account for that and think about how the tissue flows, so that when you have the patient smiling and talking and communicating, that it looks like it's natural and it's not two teeth that don't fit. So one very important photo here is for the ceramist to know exactly what the natural teeth look like. So we do a shade tab photo, and in addition to that, so that they can see exactly the tissue architecture, so that the real teeth can be here. The permanent teeth can be fitting in these areas right over here on this side, and again on this side, not being too long, following proper proportions, about 1 millimeter short of the centrals so that it looks natural. And this is what it looks like from the front. Again, like we talked about, it's all about the shapes, finishing the Maryland bridge in the tissue area so that it's tight enough, but also able to clean. And really important also is, are you doing 2 wings or 1 wing? And so that all depends on the person's bite, how much tooth there is to hold on to, so many different factors. But if I can, I try to keep it to 1 wing on a side, so that the patient, he can then floss in here. And when he comes to the office to see our hygienist, he has no excuse as to why he's not flossing in that area. And also, as you are able to bond to this one tooth, I believe that those single-sided Maryland bridges are just as strong as double-sided wings. So we call them wings in dentistry, and I think that 2 wings in his mouth is good enough, 1 on the left and 1 on the right. So this is what it looks like from that exact same viewpoint. This is once it's bonded in, and that contact here is ideal. And then also he's able to pass floss through here, and cleansability, super important. And this is what the smile now looks like. You can see there's no black looking through gray aspect of the tooth. The shapes of them are identical to what a natural tooth should look like. And here you have a smile with someone that feels confident, doesn't have teeth that are sticking out further than they should be, and colors and smile that blends in with him, so that he can now forget about this whole journey that he's been through and move on to and tackle the next part of his life.